Okay, I think we can get started. So before we jump in, please know that we'll be sending out a recording of this webinar and a copy of the deck to everyone who registered within 24 hours. So we encourage you to provide it to anyone on your team who couldn't be here who would find it useful. And with that taken care of, we can start with some introductions. So my name is Ashley and I lead product marketing here at Ovation. Ovation is a scientific data company committed to unlocking the potential of human genomics for development of life-changing therapies. And we have the premier LIMS LIS solution in the molecular diagnostic space. And next slide, we can talk about the speakers. So we are thrilled to be partnered with Arkstone, who is the leading provider of molecular laboratory infectious disease reporting and proactive antimicrobial stewardship. So from Arkstone, I am thrilled to be joined today by Dr. Ari Frankel, co-founder and chief science officer, as well as Saul Levy, the co-founder and chief customer officer. I'm equally excited to be joined by Dr. Lee Schmidt, who is the chief science officer and partner at ClearLab Consulting Solutions, and will be able to provide a lot of great insights on this topic from both scientific and lab business perspective. So just to confirm, we're all in the right place. This webinar is for independent laboratory leaders who are looking to start offering more value to their provider clients, or independent laboratory leaders who are looking to further refine their strategy or learn more about the value of providing antibiotic treatment recommendations to their provider clients. So hopefully you fall into one of these camps so that the next 30 minutes is insightful to you. And here's what we have planned. So the Arkstone team will tell us about the reasons why providers are looking to labs like yours to provide antibiotic treatment recommendations and how their solutions help your lab meet this need, as well as how your LIMS optimally works together with the antibiotic treatment recommendation technology. We'll also get Arkstone's perspective on how providing antibiotic treatment recommendations is a competitive advantage for your lab and what they've seen with their customers, and hear from ClearLab Consulting Solutions on the same topic from the lab's perspective, even sharing some real life lab stories that we can all learn from. And then we'll have 10 minutes of questions after the 30-minute presentation. So please feel free to submit your questions to the Q&A box in Zoom throughout the presentation, and we'll handle them in bulk at the end of the session. So don't worry if we don't handle your question in real time, we will get to it at the end. So with that, I will pass the presentation to the Arkstone team.
Thank you for that. My name is Ari Frankel. I'm an infectious disease physician, co-founder and chief science officer of Arkstone. I want to give you all some background about where we started from and where we are now. As an infectious disease physician, it didn't take me long to see in my own practice the massive threat of antimicrobial resistance. And part of the reason for this is the overutilization of antibiotics by healthcare providers. This stems from difficulties in selecting the right antibiotic regimen, to a lack of understanding of the information clinicians receive from the laboratory, to a delay in diagnosis, and broad spectrum use of antibiotics when in many cases, antibiotics are not needed in the first place. Seeing the need for antimicrobial stewardship or programs designed to educate healthcare providers on appropriate use of antimicrobials, I worked to develop these programs across several hospitals in remote areas. However, the problem of antimicrobial resistance is greater than just my own efforts. With most facilities in the United States not having access to infectious disease experts, and with most facilities unable to provide antimicrobial stewardship programs, Arkstone was formed, which uses artificial intelligence to bring infectious disease expertise around the world. Our mission is to change the way doctors understand and treat infectious diseases through the use of revolutionary technology and artificial intelligence. This is why Arkstone is so different. People who see the One Choice report are fascinated with the way the information is presented. And that's because we're not just a lab report or a reporting solution. There's so much more to what we do, and I will share that with you shortly. The global burden of antimicrobial resistance is pretty astonishing. As you can see, fewer than 1% of healthcare providers are trained in infectious disease. Estimates by the CDC demonstrate that 1 in 3 antibiotics are prescribed when they aren't needed or used inappropriately. Some studies have shown that 50% of antibiotics are prescribed incorrectly or unnecessarily. This translates to billions in healthcare costs. More importantly, studies have shown that antimicrobial resistance will be a leading global health concern and will continue to contribute to 10 million deaths per year by 2050. According to some, antimicrobial resistance has killed more people than HIV and malaria in the year 2019 and have led to 1.2 million deaths globally. So understanding the massive impact of antimicrobial resistance and the contributor to antimicrobial resistance, which partly due to overprescribing, you can see how big of a problem this really is. So it's therefore no surprise that the government came in here to form regulations. CMS, the World Health Organization, the United Nations, the CDC, the Joint Commission, you name it, have advocated for interventions to prevent the overutilization of antimicrobial resistance. Antimicrobial stewardship programs are now required in many settings, including nursing homes, hospitals, as well as a requirement for many joint accredited institutions. However, this is not enough, mainly because most institutions do not have access to the tools they need to implement these programs. More importantly, they don't have the expertise. We see that this is especially prevalent in outpatient settings and non-academic facilities. So Arkstone's solution is to empower prescribers to provide precision-guided medical care by seamlessly bringing infectious disease expertise right to their fingertips. We bridge the gap between your lab and the provider, bringing the tools they need to make evidence-based clinical decisions. What you see before you is the One Choice report, designed to provide targeted patient-specific recommendations at the moment the lab provider receives their results. This is not a lab reporting solution in the traditional sense. This is a guide providing the latest evidence regarding how to treat infections to the provider's fingertips. The One Choice recommendation is provided in every report, and this provides a singular treatment regimen, which with a dose and a duration, based on the variables the lab detected, it's the most effective, most narrow spectrum option, assuring the infection is treated most effectively with minimal exposure to antibiotics as possible. The information presented is based on the most available evidence, whether CDC guidelines, FDA guidelines, the IDSA, or other evidence-based publications. And the original sources for all the recommendations can be accessed easily through each report or on our website. Each report also has alternative treatment options. They will always be provided in every report. And this is for scenarios where the One Choice may not fulfill the needs of the patient or the healthcare provider. You will almost always see additional options on our reports. The other paragraphs on the report are dynamic and address many important things, such as when treatment is needed or when treatment is not needed, special considerations as it pertains to resistant genes, microbes detected, or the diagnosis at hand. The report even presents additional duration options to account for the many nuances and complexities a provider may see in clinical practice. Lastly, infection control measures are presented so that healthcare providers keep their patients safe, keep themselves safe, and prevent the spread of disease. Another important aspect of the report is how we narrow in on what needs to be treated, because not every organism that is detected requires treatment. You can see which organisms are being targeted simply because they are bolded. Lastly, the ARC scores, as you can see on the report, are provided in every report, and they are used as an educational tool to provide insight on how complex an infection may be, how important resistant genes are regarding these results, and how antibiotics compare to each other as it pertains to adverse reactions. The One Choice Plus, which is accessed through our QR code, provides even more features. Drop-downs are provided with additional education points with each paragraph. Original literature can be accessed for review. Additional treatment options are listed as well. Reports can even be translated into different languages, such as Dutch, Spanish, Portuguese, Hebrew, French. Most importantly, the meds matrix can be accessed here, which is an interactive matrix showing the reasoning behind why an antibiotic can or cannot be used, whether it's a pediatric concern or an allergy concern, or whether there's a resistant gene inhibiting its use. Here you'll see why an antibiotic was selected or not selected. Providers can see for themselves simply by hovering over the icons. You can try it for yourself right now on this webinar by scanning the QR code. And I'll give everybody a moment to do that if they choose. Turnaround time is usually within minutes, but on occasion it can be slightly longer if a report requires additional attention by our QA team. Arkstone becomes the eyes and ears of the lab, assuring results make sense clinically and fielding questions directly from the lab. A recent lab partner noted to us that their phone calls from providers have nearly disappeared since using Arkstone.
Through Ovation, the integration between Arkstone and your laboratory is seamless. Simply enter the API credentials provided by Arkstone into Ovation to activate the interface and get started. Once integrated and live, lab result data along with patient data and demographics are automatically transmitted to Arkstone. Through a combination of AI and, of course, infectious disease expertise, the one-choice decision engine analyzes all variables sent by the lab and generates a one-choice report to deliver the most optimal treatment regimen with up-to-date guidance for clinicians. The one-choice report is then sent back to Ovation, where it combines with your current lab report and uploads to your portal for your providers to view. There is no extra work for the laboratory or your providers and no additional personnel needed. It all happens seamlessly in the background. Attached with each lab result, the one-choice report will guide your providers and give them the tools they need to make evidence-based clinical decisions. Your providers will ultimately come to rely on the one-choice report, contributing to provider retention and appropriate utilization, and of course, the growth of your laboratory.
In line with CMS regulation, Arkstone provides the tools nursing homes or facilities need to help satisfy the CDC core elements in antimicrobial stewardship. The monthly report takes data across any given period of time and presents the antimicrobial trends, the antibiotic resistant trends. The report is carefully designed to be in line with the CDC core elements of antimicrobial stewardship. Facilities often use this report during their monthly QAPI meetings. Portal access is given to all labs who integrate with Arkstone. Here, labs can stay in control and can track lab report progress, trends across each state, and even see how many providers are actively using the lab and how many facilities are in real time using the lab. In addition, labs can download the one-choice report and the monthly report directly from the portal. Reports can be redacted and used for marketing purposes. They can even upload lab results manually if they choose. Lastly, they can activate certain features like the Meds Matrix PDF report, which can accompany the one-choice report. More and more features are being added to the portal, such as messaging system to alert clinicians as to when a one-choice report is ready. Arkstone currently works with many laboratories across the country. We are over 5,000 providers and have currently used the one-choice or have used the one-choice at one point in time. We have over 3,000 facilities that have worked with Arkstone, which translates to over 150,000 patients. The benefits to Arkstone and the advantages to the one-choice report as it compares to the traditional lab is obvious. Besides for presenting treatment guidance based on the evidence and promoting antimicrobial stewardship and participating in the global effort to prevent antimicrobial resistance, laboratories see growth across the board. 35% increase in lab utilization is noted, as well as expansion to other panels across time. So we see labs that start with small panels eventually expand to larger panels because of the ability to understand the results and use it appropriately. We see lab provider retention increase as well, and labs also expand to additional markets like the long-term care facilities. Arkstone isn't just a tool the lab uses. We are your partner. We work closely with your lab day to day, from co-marketing materials to co-branding to our support team that readily answers questions and provides education to those that need it. To sum things up, providers need clarity on the results they receive, because without the one-choice report, often confusion results, which leads to low retention rates, misuse or inappropriate antibiotic use, and decreasing clinical productivity. Lastly, antimicrobial resistance will not solve itself. And only through a collaboration can we begin to make an impact on this growing threat. We are in this together and looking forward to working with you all soon.
And there was a question that was posted. I didn't know if Ari or Saul wanted to hit that one before I started, because I think it's actually a pretty intuitive question. You see it?
If it's in the chat, I'm not seeing that one. It may have been a specific question.
Q&A.
I can pose.
Oh.
Ashley, do you want to pose the question?
Yeah, so the question is, how do you differentiate between human flora with ABR versus infectious diseases with the same ABR present?
A good question. So one of the, I guess, advantages that can sometimes be a disadvantage when working with molecular is the fact that it's very, very sensitive. So the molecular test can often pick up microbes and resistant genes in the environment as well. What Arkstone does is two things. Number one, we focus on the microbes that the literature notes as a high rate of causing infection. So for example, when we're working with urine, E. coli is a very probable cause for UTI versus a urogenital colonizer, whether it's uriplasma or whether it's a coag-negative staph. So right off the top, the report is going to focus on those microbes that the literature supports are the common cause of infection. However, we also provide treatment recommendations somewhere in the report or in the One Choice Plus for those microbes that are not the focus of the report. This way, the providers can still treat those if the provider chooses to. When it comes to resistant genes, our software correlates the resistant genes with the microbe that's likely expressing it. So if we see a MEK-A gene, which is associated with staph, and E. coli was detected, our report will note that, and it won't apply that gene to the E. coli when recommending treatments. Also, if we are focusing on treatment of a certain microbe, we will make those associations so that the provider knows which resistant gene is being focused on as it pertains to which microbe. One more point to make here is that the meds matrix also shows this too. So when you go into the meds matrix and you hover over each resistant gene and microbe, you will see which organism is likely expressing that gene and which organism may not be expressing that gene. And so this way, the provider can understand the correlations that we are making on the report.
Great. I think we have a few more questions entered, but maybe we will handle those all together during the Q&A session. So please keep them coming and we will address those after Lee, we hear from you.
Fantastic. I wanted to just stop when we saw that one because I thought it was a pretty intuitive question.
Oh, yeah.
How the report interprets itself. So I'm Lee Schmidt. I'm a Chief Science Officer and partner of Clear Lab Consulting. So I help build laboratories as small as physician-owned laboratories and going all the way up to larger reference labs. And what I noticed over the last 2 years was there's a lot more competition in this space than there used to be. And how do you differentiate yourself from just a standard run-of-the-mill molecular report, which basically says, we detected all this stuff, congratulations. As Dr. Frankel mentioned, less than 1% of physicians out there actually have any sort of knowledge in infectious disease. So we were having some people who were using the service and actually not understanding how to interpret the report, and we're going back to culture and sensitivity because it said, hey, look, this bacteria is sensitive to this antibiotic, so they would use that antibiotic and move on. Well, of course, that's how we've gotten to this situation that we're in today. So when trying to do in response to some of my clients' requests and says, we need a better competitive edge, is when I actually came across Arkstone. And in conversations with Saul, when we first started, he was just like, we're already partners with Ovation. It makes it incredibly easy. I went back to Ovation and said, hey, is this incredibly easy? And they said yes, and I can actually vouch for it. It is incredibly easy. The system itself is designed to work with Ovation's interface. The Arkstone interface is fluid. You don't really see anything on our end if you're an Ovation user. You send the data off. Minutes later, an Arkstone report comes back. And for my clients who have used it, it has given them a competitive edge. One of my larger labs in Salt Lake City went on to Arkstone and really developed a regional competitive edge, so much to the point where I have a physician-owned laboratory in that same region, and they were telling me about this new reference lab that's using this special report. I was like, I know who that group is. And so they actually, that physician-owned laboratory ended up going on to Arkstone as well because it started making waves. Same thing in the Midwest here near Louisville, Kentucky. I had a lab that went on to Arkstone and really set a banner month. And they started in Arkstone in December, and this month set a record for specimens processed through the lab. So it is making a difference. That reference lab services long-term care facilities as well as they're very much a large regional lab. So it has really changed how they're able to provide services and then what the impact is to the physician. We know in the current healthcare space especially that primary care physicians and nurses don't have time to really dig through a report that's got a lot of verbiage on it. This is where the One Choice report hits a home run. You get a score right at the top, you see exactly what's going on, and you know exactly how to proceed. But if you need to geek on it a little bit, that QR code is a game changer. So, I was pleased that both Ovation and Arkstone asked me to come speak about it, because it has given me as a consultant a tool to offer my clients a very competitive reporting system, and one that you can integrate with. It doesn't matter what kind of panel you have. You don't have to use a preset panel. If you've got a custom panel you've designed, Arkstone and Ovation can make it work. So yeah, I'm really happy with the product.
Great. Thank you so much. That was really helpful. So I think now if we go on to, so just before we jump into, we have plenty of time for lots of questions, so we will go through all of those. I just wanted to give people some takeaways just in case they need to leave. So how you get started, if you can learn more about the power of Ovation limbs by signing up for a demo and a conversation with one of our qualified representatives by emailing sales@ovation.io, and we'll be sure to connect you with Arkstone as well. And if you don't need a LIMS at the moment, you can contact Arkstone directly at info@arkstonemedical.com. And if you're already an Ovation user and you're interested in adding the Arkstone integration, just contact your Ovation account manager or fill out a project request form, and we can discuss next steps about how to get started. So with that, let's move into the questions, because I know we have a few now. Please take a minute to put your question in the Q&A box if you haven't already. And I do see a few. So first question that we have here is, does Arkstone have a LIMS, or should it integrate with other LIMS? So yeah, so Arkstone does not have, I'll answer for you guys, I guess, since LIMS is my area, but Arkstone does not have their own LIMS, but is seamlessly integrated with Ovation as well as many other LIMS companies. Like we said, the Ovation process is very easy. It varies across the board for other LIMS, but pretty easy integration, I think, across the board. If you have anything to add, Saul or Dr. Frankel, to that.
Yeah, I can just add on a bit to that for a moment, where Ovation has really taken the lead from an integration standpoint. So a lot of times laboratories who have a desire to get started right away may see some sort of artificial delay, I would say, in getting the interface up and running with their current LIS. But with Ovation, they've really pushed that ball forward, where, as I mentioned earlier, it's as simple as getting the API credentials from Arkstone and activating the interface within Ovation to really get started. So they really cut out a lot of the potential process. And as Ashley mentioned, it's a very seamless and efficient and quick process with Ovation.
That's great. Okay, great. So next question, does Arkstone work or provide treatment options only related to molecular testing, or correlate with all types of testing like clinical chem or hematology related results?
So as it stands now, we are only involved in the infectious disease space. In the future, we're exploring going to other areas in medicine, but currently none of that's available.
Yep. Okay, great. Plenty to handle with infectious disease, I think. Okay, great. And then we have a question about Palmetto GBA is enacting significant requirements on molecular testing as it relates to microbiology. Will Arkstone be able to assist with those requirements? If the Arkstone team can speak to that.
First of all, you're able to be a little bit more specific as far as what requirements you're referring to. We do know that there are some new guidelines coming out as far as reimbursement for Medicare, and we are working with a lot of our partners to sort through what all that means. There's a lot of ambiguity about that. A lot of people don't really get what's going to happen, and so as this unfolds, we are working with our partners and lab partners to figure out ways to adapt to these new changes, and of course work within the guidelines and what's recommended clinically. But just so that I know I'm not missing your question, are you able to elaborate a little bit more on that?
Yeah, I think that was from Chad. So Chad, if you would like to type some more info, and otherwise we can I can provide Dr. Frankel with your information to follow up after, if not.
I can add to that a little bit. I actually, in process of registering several tests with Palmetto's MolDX program, and in the technical assessment, I described pretty thoroughly that the partnership with the Arkstone reporting provides a clinical advantage and so forth, because you do have to provide a clinical justification of the molecular aspects of the report. So I did use that to my advantage, and I've had good responses from Palmetto. Provide, the fact that we're not just spitting out a report that's not providing actionable options. That's really what they're looking for is are you providing a test or a diagnostic that's providing actionable data and results, and so in that TA form, when you fill that out, this does give you some stuff to talk about.
Great, thank you. And this is a great question that I think speaks to, also maybe we could reiterate again, I know you guys mentioned it a little bit, but the types of clients that are most looking for an Arkstone report. So we have a question, would an ACO/IPA gain a lot of value working with the lab utilizing Arkstone reporting? So maybe we can start with the Arkstone team speaking to the types of clients that get the most value out of the Arkstone report from the lab. And then Lee, if you have anything to add to that, I know you mentioned a few things earlier, but yeah.
So in general, we're seeing healthcare providers from really across the spectrum utilize the Arkstone report, from neurologists to primary care physicians to pediatricians. We're seeing expansion of molecular in long-term care, in home care settings. There really isn't any limitation, and that's some of the beautiful things about what we're doing, since we're making this such a seamless process and we're making the results have real clinical value, because we're able to take that information and use it appropriately. We're seeing that there really is no boundaries, and that's part of the reason why a lot of laboratories work with us, is because now that we can make this complex information that's coming out of the laboratory applicable, and now that providers understand what this information means, they're applying it themselves naturally to other scenarios. We've had providers ask laboratories, can we use this for other things? Can we use this for GI illness? Can we use molecular for respiratory, for wound? And that's really opening up people's eyes to the possibilities with this type of technology. So it's really limitless, in my opinion.
And I do have several labs that are using multiple panels on Arkstone reporting, and all they ask for is tell us the source, which is, again, the usability makes it simple. When you say this is a nasal and this is a respiratory panel, and then their report will change. It'll change its recommendations, and again, a beautiful answer on my side. But just when I need that kind of flexibility. All my clients are drawn to this, whether you're a small physician-owned laboratory or even just a podiatrist office, which may have a lab that I've put in for them. Again, because it gives you, there's some subtleties that are in the Arkstone report that are not in a standard report. One of the things that I'd like to cue into is asymptomatic bacteremia, and the Arkstone report very elegantly describes, yes, you may detect something because PCR is incredibly sensitive, but you don't need to necessarily treat asymptomatic bacteremia. There's a whole paragraph on the report that describes what should be treated, what should not be treated, isolation procedures, those things like that. And again, all that changes to what was detected on the panel. I love that, and I guess a lot of my other clients are like that too, because now they're not pegged. If you just get a regular PCR report that says we've detected Staph aureus, that's it, right? In the statement, they almost have to do something in order not to be negligent. But if they follow the guidelines, or not necessarily guidelines, but recommendations of the Arkstone report, they can sit there and go, okay, yes, we did detect Staph aureus. It's asymptomatic. Let's just watch the patient. Maybe we don't need to prescribe something. That's another very valuable, and I think one of the advantages is now my physicians aren't pegged with reflex treatment just because something was positive. They can now use the whole picture. Yes, I'm looking at the patient. The patient is asymptomatic. Yes, I see something here, so we're going to watch him close for the next couple of days and see if it resolves, or if I need to interfere. And that's just, again, helping the patients or the physicians, the providers, really have good tools that can be used.
Great. So I love this question for the Arkstone team. How often is the antibiotics guideline database updated? Are the results from clinical lab reviewed by pharmacists or doctors? Explain a little into that.
Yeah, sure. We have a quality assurance team that is reviewing all the data on a daily basis, literally every single day. Our team is composed mainly of infectious disease doctors, but we have highly trained mid-levels that work with us as well. So our team is focused on the clinical application of the information we receive, which really sets this apart from how traditionally these lab reports or overreads were done by PharmDs. Here, we're doing it by people who have experience looking at this data and applying it clinically as an infectious disease doctor would do in real life. Except here, the computer is using artificial intelligence and our team is supervising the computer and making sure that data is accurate and the data is up to date. But just really as a one-liner, we update this information daily. So if a new guideline comes out by the CDC on COVID, or whether it comes out on STD information, or we have a new FDA warning that comes out, you will see that on the Arkstone reports. And we also do have newsletters that go out where we have any new information that comes out that's very interesting that we find that laboratories and healthcare providers would need in actual practice. We provide that as well.
Great, thank you. And I know we mentioned turnaround time a little bit, I think earlier, but if we could talk about that a little bit. So what is the turnaround time for reading PCR data to produce the Arkstone report?
Go ahead, Dr. Frankel.
I was going to let you do it.
Okay. Generally, you'll see results come back within a few minutes, very quickly. Sometimes it could take a little bit longer, up to an hour, sometimes a bit longer, depending on the result. We pride ourselves as being, as Dr. Frankel mentioned earlier, the eyes and ears for the laboratory also. So we want to make sure there are no errors in the lab result. The data is clinically relevant. And if our quality assurance team notices something amiss, we'll reach out to the laboratory right away. And more often than not, the laboratory appreciates that and wants to rerun the sample. So those are some of the things that we work to implement in our quality assurance process, which can stretch out the result time a bit more. But generally, as a rule, you'll see the results come back and the reports come back in minutes from the time we receive the data.
And to provide some user input on that. So it is your job as the laboratory, though, to follow your own QC for results itself. So you need to have your acceptance criteria per your validation. And once you accept that as a passed test in your lab, that's when the results get submitted over. It'll be after your QC step in Ovation. Then the results go over to Arkstone, and then that's when they do their QA step. And I love that feature because I have had them reach back out to me a couple of times and go, "Is this real?" And it turns out it was a proficiency test where everything had popped positive, and they flagged it. They're like, "There's no way everything on your panel is positive," but that just goes to show you they do look at things, which is appreciated. But there's two levels of QC. Your internal results are on you. And you need to make sure whatever you do submit to Arkstone, it passes your own lab's validation.
Great. And then a related question from Sam is, can we get results 7 days a week?
Yeah, so of course, reports are being processed, as I mentioned, generally within minutes, 7 days a week. If there's a specific report that requires additional quality assurance over a weekend, it may take a few more minutes, just a bit longer. But as a general rule, 7 days a week, and you should expect your results to come back very quickly regardless.
Great. Okay, great. And then how many molecular assays are handled by Arkstone? Or maybe another way to put it is, I think you guys handle most infectious disease assays, or if you want to handle that a different way, I'm not sure. Answer that a different way.
So we handle anything infectious disease related. So no matter the panel, no matter how many targets are in the panel, we're ready to handle whatever the lab sends. So across the board, anything infectious disease related, we provide a report for.
Great. And then we do have a question just about the kind of payment structure. And I think just if Saul, you want to answer quickly about, you know, how it's set up with the lab. And then I think the best way probably is people to contact you for the team for more information on how it works more specifically. But yeah, just a little bit on that.
Yeah, sure. Yeah, so it's very simple. We work off monthly volume. So just as a general rule, you can expect to see a tiered system that starts at 500 reports and under. You'll see lab results at a cost of $25 per report. And then once a lab goes over to the top end of 2,300 reports, all lab results are $15 a report. And of course, decreasing tiers as the volume goes up between 25 and 15. So wherever you fall in that given month, that will be the price per report across the board for all your results. One more thing I'd like to mention is that from an integration fee standpoint, we waive that with Ovation. Of course, given it's so seamless, generally we have a $3,500 fee for an HL7 integration and a $2,500 fee for an API integration, but we fully waive that with Ovation. So all it is, or the only cost you'll see is that cost per report as you start sending Arkstone lab results based on that volume.
Great, excellent. And then I think we have one last question here for you again, Saul, I believe, is just, could you speak a little bit about maybe both when labs or providers have questions for your team and what that looks like in terms of like the availability around the clock, or, you know, what that kind of structure is and what you set up there? Sure.
So if a provider has a specific question about a report, they can call the phone number that's on each One Choice report on the bottom left. If someone is available to answer the question right away, someone from our clinical team will handle that. If not, a message can be left and they'll be called back as soon as possible. If anyone at the lab has a question, they can email support@arkstonemedical.com. They can also go to our website to our FAQs, and a lot of the questions anyone may have, they can be found there as well. But if there are any additional questions, you can reach out to, again, support@arkstonemedical.com. When we speak to you specifically after this webinar, we can give you some other contacts to reach out to, perhaps some personal contacts for any questions as our relationship continues to go on. So as we mentioned on this call, we're here to work closely with your laboratory. From the integration process to the marketing material to the co-branded material, and any questions that providers or your sales team may have about the Arkstone report, we'll provide them that material. We'll answer any questions they may have, and we're looking forward to working closely with you. Okay, great. Thank you for your participation, everyone. It looks like we were able to get to every question. So, of course, follow up with either of our teams with any follow-up questions, but otherwise, just please look out for the recording and the deck, which should hit your inbox in the next 24 hours. And we'll also include a sample combined Ovation and Arkstone One Choice report attached to that email, so you can take a look at that more closely and get a feel for what that could look like coming out of your lab. And other than that, just thanks again for your time and have a great day, everyone. Thank you all.
Thank you.